The country was unprepared for COVID-19. Pandemic coffers empty. PPE supply diminished. Testing capabilities non-existent. Democrats blamed the Trump administration.
Unfortunately, up until now, the Trump administration has mounted an opaque and often chaotic response.
Trump blamed his predecessor.
Don't forget, the cupboard was bare. The other administration, the last administration, left us nothing.
The funding cuts spanned 3 administrations and many Congresses. Advocates say Democrats in Congress are on the verge of making the same mistake.
Those who fail to learn from history are doomed to repeating it. And we are in danger of repeating a history that we cannot afford to relive.
Dr. Anthony Fauci agrees, saying last summer,
I do hope that with all the pain and suffering that the world is going through now with COVID-19, that we do not forget that when we get through this, which we will get through it, that we know that it will happen again. It certainly will. And that's the reason that I think we really need to push to have a sustained commitment.
Congress is considering as little as $5 billion for pandemic preparedness for agencies including the CDC and NIH. The Biden administration is asking for a minimum of $30 billion.
The money is a drop in the bucket of the more than $3 trillion bill that Democrats are writing right now, filled with their priorities of child care and paid family leave. But pandemic preparedness isn't one of them.
Congress is not yet committed to funding that $30 billion. That's right. Public health infrastructure and pandemic preparedness has been chronically underfunded. It's not a sexy topic. No one gets rich off of preventing pandemics. You can't take a photo op in front of a pandemic that never happened. And there hasn't, as of yet, been the political will to make this funding actually appear.
Prevention, advocates say, would develop tracking and testing mechanisms, advance personal protective gear, and even get a head start on vaccine development, all critical for combating a pandemic. Years of research on the mRNA vaccine, including millions in government-funded research, is part of why a vaccine was developed so quickly for COVID-19. Upfront spending, advocates say, would save money and lives. The current pandemic has cost trillions of federal dollars. More than 600,000 people have died.
Defunding pandemic preparedness during a pandemic is a little like defunding counterterrorism after 9/11. It's so irresponsible and so unconscionable as to be unthinkable.